Senator Cassidy.
Mr. Tomasato and Mr. Zakin, I've been struck that people's medical data is commonly used by people who make billions, trillions of dollars, but their data doesn't contribute anything to their own financial welfare. Now, there is that indirect benefit of medical advance, but there's nothing like, my gosh, I had the one gene that was a cure for Alzheimer's, and somebody's going to do really well on it, and I get zilch. Now, we've seen litigation on this in the past, and now I think there's informed consent that your data can be used. But I think it would incentivize Americans and it would share the wealth if you could actually have a distributed ledger in which the monetary value of my contribution would accrue to me with financial advantage. Does that make sense, or am I speaking too kind of like highfalutin?
No, it makes sense.
Yeah. So how do you do that practically? How could you make it so that if Senator Crapo's lab test and clinical data were used to, or 23andMe, which has been monetized, but not accruing to the benefit of the person who's contributing the genetic material? How do we set up that system where it would accrue to my advantage as well? Not entirely, but to somewhat. Any thoughts on that?
I mean, I think as an initial matter, I would say it's an incredibly complex problem, but it's the type that developers in this.
Now, why would it be complex if we say, okay, everybody's data is going to be tagged with a wallet, and we're going to track it as to who is using it, and whenever it is used, there'd be some, system. For example, there might be 10% of all shares of a certain product, which will be distributed among those who contribute clinical data, that sort of thing.
So I think probably like one topic that comes to mind is you're putting people's health data on a blockchain, which is generally publicly available information.
Now, you wouldn't have to put their data on blockchain. You just put the wallet on blockchain. The data can be held in a repository that would be restricted access. But if access, bing, you add something to the wallet of the person whose data was accessed. Correct?
No, these are the exact types of questions that I think some of the developers who are working on ideas like this are wrestling with, right? How do you then trust the repository that is issuing these tokens to then transact in this? There's a lot of technologies around zero knowledge proofs that come into play. We recently wrote a paper at Coin Center about dealing with digital identity on the blockchain and how this can work from a technical perspective, but also some of the policy changes.
Now, will this be entirely worked out by the market or by private industry, or does it need enabling legislation?
I'd have to get back to you on that one. I think specifically, again, digital identity is more of a proxy for maybe where you're thinking is one where we think there needs to be some policy movement to help create the environment. I would think it's probably similar.
So let me check. Does anybody else have a comment on this? Mr. Zakin?
Thank you, Senator. I think you should come and work for Coinbase because I think you're full of brimming with ideas.
Can I say that a little bit?
You should come and work with us at Coinbase on new technologies and adapting the blockchain. I would say this. I think your comment is really based on the promise of DLT, decentralized ledgers. We share that promise here at Coinbase, so I think we endorse that as well. And I think we can use that in the tax system as well. So there are blockchain. We have a tax system that is based on paper, on fax machines, that is the 20th century, and we could collect and validate and ensure through smart wallets, through attestation tokens, the use of blockchain for a much more efficient tax system, and it very much is in line with some of the things you just described. We should be innovative. We should be thinking this is what America's about. So totally endorse that.
Did you have a comment?
Well, you're describing, I think, something similar to like a ASCAP royalty, where every time radio station plays a song, they have to pay a royalty. But the blockchain could help in tracking some of that, so payments go to the right person, plus protecting their private information.
Yeah. So now, what I'm a little bit concerned about is that you're suggesting that this might be the promise. That implies difficult to realize at this point in time. And yet, would it really be, or is it just a question of working it through to where we actually could democratize the financial benefit of medical advances to the people who are actually contributing the clinical information? Does that make sense? I mean, and this you may say, I don't know, you got to think about it, but it does seem like you put a bunch of smart people and you try and trace it out do it for one person, then you scale it. Am I being too optimistic or not?
Well, I think a lot of people aren't thinking about the value of their information, and we give a lot of information away all the time that perhaps has value to it.
We have a whole group at Coinbase called Base that works on initiatives that tries to effectively allow people to monetize their self-created property and things that you just described.
So I'm out of time, but if you, my staff is available 24/7, 365. And so if you all have thoughts as to how to do this, I'd appreciate this because I think this would actually, you know, they say in our society currently you can make a killing, but you can't make a living. We need to make it so that everybody is enjoying the benefit of the data which they're contributing for others to make a killing. That's my thought. Thank you, I yield.